Welcome, everyone, and thank you for joining our virtual voyage of the Aging and Memory Loss Roadmap Education Series. We are so grateful to have so many people here. My name is Nancy Koppelman, and I am the co-director of Community Outreach at the Center for Alzheimer Research and Treatment, also known as CART. Today, we will present the fourth part, Roadmap to Prevention. A little background. The Roadmap series is a four-part comprehensive program about aging and memory. Some of you may have attended the other three this summer, or others at the Brigham before COVID. The series is a culmination of our work in the community and at neighborhood health centers, where people frequently asked us to prepare a guide for those who are walking this challenging path. A few details: you should have all received your electronic companion guide for today's presentation. If not, please email us and we will send it to you. You will be muted for this presentation. If you have questions, please put them in the Zoom chat. We will also send you an evaluation form for today's program. Please complete, as we value your feedback, and sign up to join our education registry. I would also like to introduce today's speaker, Dr. Seth Gale. Dr. Gale is a behavioral neurologist at Brigham and Women's Hospital and an instructor of neurology at Harvard Medical School. His research interest is in lifestyle and non-pharmacologic interventions to reduce the risk of dementia and cognitive decline, including the use of mobile health and other technologies. Dr. Gale works on multiple clinical trials on aging and Alzheimer's disease at the Center for Alzheimer Research and Treatment, and is also interested in medical ethics and the optimization of cognitive testing and clinical care for dementia. Now I'm turning it over to Jennifer Trotter, our collaborator at the Global Alzheimer's Platform Foundation.
Thank you, Nancy. Good afternoon. I'm Jennifer Trotter, Senior Manager of Recruitment and Program Services with the Global Alzheimer's Platform Foundation. I'm so happy to be part of this webinar today, and I applaud you all for taking the time to join us. We're really in for an informative presentation. A little bit about the Global Alzheimer's Platform Foundation. GAP is a nonprofit organization that was established in 2016 with the goal of seeking to speed up drug development for Alzheimer's disease. And more recently, we've added Parkinson's disease as well. You are so fortunate to have one of our member sites here in the greater Boston area, the Center for Alzheimer Research and Treatment at Brigham and Women's Hospital. I work closely with their study team to support them and address any barriers that may slow down their work. You've got a top-notch team here. As our GAP president reminds us frequently, the first person cured of Alzheimer's disease will be in an Alzheimer's clinical trial. Enjoy the webinar, and now I'll turn the screen over to Nicole Chan. Nicole?
Hi, everyone. Thank you, Jennifer, and thank you, everyone, for joining. I'd like to tell you about an opportunity that we have at the end of the talk. If you're able to stay on the call, we will be having some of our certified raters from our site to be available for free memory screening. So be sure to stay on the call at the end, and I will go into further instructions. If you are interested in the screening but not available today, just complete the survey that will be sent out to you after the talk, and to indicate that you're interested, and one of our team will reach out to you to schedule a separate time for you. All right, and now I will turn it over to Seth.
All right, hello, Dr. Gale here. Hopefully everybody can hear me. Thank you for joining today. Let me advance a slide. So welcome. So I'm going to try to cover a broad topic in a short period of time and leave ample time for questions at the end. And I hope that this is helpful and that people get a lot out of this talk. So briefly, what I'm going to do is I'm going to go through who we are at Brigham and Women's Hospital and Mass General Hospital in Boston, what we do, what our missions are. I'm going to then talk about normal cognitive aging and the spectrum along the pathway of aging that includes mild cognitive impairment and dementia and Alzheimer's disease. I'm going to spend a little time talking about the evidence behind the main topic here, which is the title of the talk too, which is lifestyle and brain healthy behaviors that can reduce the risk of cognitive decline and dementia. And then I want to spend the bulk of time talking about brain healthy behaviors and practical lifestyle actions and behaviors that you can take to reduce the risk of cognitive decline and dementia. And I hope that that's a real practical part of the talk with the topics that you can see covered here on this slide. And then a little bit at the end about your involvement with clinical research and trials. So the Center for Alzheimer's Research and Treatment, or CART, and the Center for Brain-Mind Medicine are the research and patient care centers at Brigham and Women's Hospital. And you can see that here. At Mass General Hospital, there's similar groups that are involved with both clinical care and research, the Memory Disorders Unit, or the MDU, and a group that's called the Alzheimer's Clinical and Translational Research Unit, or ACTRU. So I'm speaking today on behalf of this group to bring you this information. These centers help to disseminate information about Alzheimer's disease and related dementias, and they're the seat of clinical trials and studies throughout these two institutions. And an umbrella organization which helps to organize the centers within these two groups is the Massachusetts Alzheimer's Disease Research Center, which is one of the NIH-funded centers nationally that has dual missions of community education, disseminating information, and sponsoring clinical research related to Alzheimer's disease. And you can see the relationship here that Brigham and Women's Hospital entities and Mass General both work within Massachusetts Alzheimer's Disease Research Center. And so the MADRC is involved with community outreach with programs like this, collaborations with faith-based communities, and we also do a lot of outreach for continuing medical education and supporting primary care doctors and other specialty practices in the area of dementia and Alzheimer's work. Okay, so normal cognitive aging versus dementia. What do we mean by all of this terminology that we use? So what I'm going to show you is a couple of different categories of the spectrum, if you will, from normal aging to dementia. So let's look at this graph here where my pointer is first. So on the x-axis, you can see age. As people get older, they progress in this way. And cognitive function is on the y-axis. So first, if we just take a look at this purple line here, this is the curve of normal aging. So you can see that as everybody gets older, we all lose some cognitive function slowly over time. Now, this is the trajectory that everybody wants to be on, right? We want to try to minimize cognitive decline with aging. Now, for various reasons related to genetic factors and other risk factors we'll talk about in this presentation, some people are on this trajectory or a similar one that involves subjective cognitive complaints, that is people that worry about memory, mild cognitive impairment, and then diseases like dementia. Alzheimer's disease is the most common type of dementia. And so subjective cognitive decline, this first category, is the experience that people may have of worsening memory or cognition without actually having abnormalities on memory testing. And subjective cognitive complaints or decline itself is a risk factor for development for Alzheimer's disease. So it needs to be taken seriously and can be evaluated in the medical system. This second category we use, which is a term many people may have heard, is called mild cognitive impairment. And this just denotes somewhere in between where people are functioning normally or they have memory complaints and they actually have interference with daily functioning, which is what we call dementia. So mild cognitive impairment is a term that intentionally lies between normal cognition and interference with daily functioning. And it's defined by there not being an interference with people's daily functioning abilities. And then at the bottom of this curve is the development of dementia. And dementia is a term that we use to describe when someone has enough memory difficulties that it begins to interfere with their daily functioning. And we use concepts or activities like cooking or shopping or driving and various other activities of daily living to measure whether people have declined to that level to have this term dementia applied. So for the statistics mentioned here, so at least 14% of people in the US alone over the age of 71 meet this definition of dementia. And in general, the rate of conversion, that is for people who in 1 year might have mild cognitive impairment, but in subsequent years develop or progress to dementia, is somewhere between 5 to 15% per year per individual. So this is why it's important to follow up, to bring it to the attention of the health system in order to be as proactive as possible to try to reduce the risk of decline. And that's the focus of this talk. So this is a question that's easier to ask when we're in person and I'm standing in front of a group of people, but does anyone know the difference between having a senior moment and having Alzheimer's disease? What is the difference? It's a very natural and appropriate worry when people have cognitive lapse about whether or not it reflects an underlying problem like Alzheimer's. So when people talk about senior moments, some of the things that people describe and are common with normal aging are things like forgetting why you walked into a room. I know we've all had an experience like that. And maybe coming back to you shortly after, maybe not sometimes. Word finding difficulties in conversation, making the wrong turns while walking or driving, so having difficulties with navigation, misplacing items around the house. So I think the main take home I'm trying to get at here is that senior moments themselves do not equate to Alzheimer's disease or early Alzheimer's disease, for example, but if they're happening frequently and they're beginning to be concerning compared to one's peers, I think it's important to bring to attention. So just being aware of it is the key, and kind of monitoring the frequency is the next step. Doctors, neurologists, or psychologists can easily do testing or screening for individuals who have complaints like this to determine if there's a problem. And there are many reasons that people can have memory complaints when they get older. They span the spectrum from low thyroid function to significant psychiatric disorders like depression that are unrecognized, etc. So these are things that can be teased out and often need to be done so in a healthcare setting. Other examples, where did I park the car? What did I come in this room for, as I mentioned? What's the word that I'm trying to come up with? Where are my keys, etc. So things to note, but to monitor and to take seriously, but not to overreact to. So I thought I would just spend a minute and show this clip. So this is from a great series on NBC called This Is Us. It's a television series. I don't know if people have seen it, but this is just an example of the challenges, one of the challenges within families related to senior moments and medical attention.
You don't seem like yourself today. You had a few mix-ups?
Oh, yeah. Miguel calls them senior moments.
Yeah, I get it. But this felt like a little more than that. The whole thing with the phone?
I'm fine, Randall. I'm fine. I'm getting older. I don't recommend it.
I know. I'm sure it's nothing. It's just wondering if you've seen a doctor lately. You know, I could call around, set something up for you while you're in town.
I'm only here for a few days, and I barely get to see my granddaughters. I'm not gonna go see some doctor just because you're overreacting.
I'm just worried that they could...
I said I'm fine.
Mom.
Randall, enough, okay? I'm still the parent here, and you're still the son, in case you've forgotten.
Okay.
Okay, what?
I'll forget it.
No. If you want to say something, go ahead and say it.
Mom, the only thing that I want to say is that I love you, and I'm concerned. You're acting extremely defensive over absolutely nothing right now, and that's only making me more concerned. And for you to say that you're the mother and I'm the son after 20 years of...
Of what?
Nothing.
I apologize. Go back to playing this.
Yeah, you did. You said something very clearly. And it was cruel. And it was beneath you. You know what? I'm tired. I think I need to lay down for a minute, so could you please leave?
So a very complicated scenario that I thought just reflects the tension that is common when these kind of issues come up with families, and there's an independence, an appropriate sense of independence, and I think either unawareness or denial of a problem. And so something to think about and consider. But it's important to advocate, as a family member, and to be proactive. As much as possible. Okay, so what is the evidence behind brain healthy behaviors in helping to reduce the risk of dementia and cognitive impairment? So generally speaking, there's an idea of modifiable risk factors. There are things that we can do or we can address as individuals and as a society to try to reduce the onset of cognitive impairment and dementia. If you have even a small reduction in some of these risk factors on a population level, you can prevent millions of cases, at least as far as this modeling goes, of Alzheimer's disease worldwide. There are on the order of 50 million or more cases of Alzheimer's disease and related dementias in the world, for example. And so when you're talking about interventions that reduce those cases on the order of millions globally, it's a significant factor. So risk factors or behaviors like smoking, sedentary behavior or physical inactivity, depression, obesity during midlife. These are factors that can change and can make a difference in reducing later life risk. This table just illustrates that with a higher reduction, with less of these risk factors, or with more controlled risk factors, there are more cases that can be prevented of these diseases. And this goes a little bit further to talk about the evidence behind these risk factors. So you can see on the top here, this red box shows that there's the strongest evidence for things like brain injury, midlife obesity, hypertension or high blood pressure during midlife, smoking, and diabetes as increasing the risk of later life dementia or cognitive impairment. And then there are some factors that we know are protective or that can reduce the risk. And the strongest evidence to date behind those include regular physical or aerobic activity, and years of formal education. The education piece is complicated and controversial because one cannot change one's childhood, formal education, but there have been many studies over the years to show that ongoing education or continuing education at any point in life can add to the protective effects of the brain. And so I think that's important to note, even in the context of recognizing that years of formal education itself is a protective factor. So this slide is trying to show that multiple interventions of brain health behavior. So for example, physical activity and adherence to healthy diets. Doing more than one is better than just one alone. And one can do a little bit of each of these as a start, as opposed to needing to achieve all of the levels of recommendations at the beginning. I think that's a really important point, that that wherever you are with your health, your individual health at this point, inching forward along the pathway of brain healthy behaviors, including aerobic exercise, Mediterranean diet adherence, and social and mental stimulating activities is going to get you somewhere, and is really important for reducing risk. So in this left slide, there's a chart which shows the evidence from the Northern Manhattan study, which is a study following healthy, cognitively normal older adults. And these different lines show different degrees of adherence to physical activity and a Mediterranean diet. And the curves that are the best, as years go on from the bottom, from 0 to 12, the curves that are the best, where people do not develop Alzheimer's and related dementias, are ones in which they have the most physical activity and the highest adherence to a Mediterranean diet. And similarly, on this side, we can see that people in another longitudinal study of cognitively older normal adults in Sweden showed that those who score highest on physical, mental, and social activity scales had lower risk, 0.57 relative risk, compared to those who scored high in only one of those activities. So people that are socially active, physically active, and mentally active in general do better and have less risk of developing dementia over time. And so right now, ongoing, there's a study called the US Pointer Study, which is a follow-on study from a study in Finland called the Finger Study, which is trying to intervene and actually promote these behaviors in healthy older adults. This is a 2-year clinical trial. It's ongoing now. I think there are 6 sites now across the country. It's enrolling healthy older adults who are age 60 to 79 who have risk factors, as I mentioned before, including things like high blood pressure and sedentary behaviors, and trying to implement a regimen of physical exercise, nutritional counseling, cognitive and social stimulation, and management of their medical problems in order to measure how they do compared to a less active group over time. So this is an exciting study that is trying to implement the evidence base we have for lifestyle behaviors in an actual study where you're intervening over time. Okay, so that's a little bit about the evidence. So there is a lot of evidence to demonstrate that brain healthy behaviors and taking care of the brain, making sure you avoid risk of injury, keeping up with general vascular health problems like blood pressure, cholesterol, not smoking, etc. There's really ample evidence to show that those behaviors can reduce the risk of cognitive impairment and dementia. So let's break it down and let's look at each of these and figure out what you can do now based on this evidence. So let's talk about diet and exercise first. So again, a bit rhetorical in a virtual talk like this, but Who has trouble maintaining a healthy diet or exercising frequently? I do sometimes. What are some of the reasons why people have trouble? So there's a lot of reasons. This is hard. It's difficult. It's difficult to achieve all of these things. It's easier to go for one or two of these over a period of a month or 2 months and feel good about it and sustain the behavior than it is to think about it as doing everything all at once. And so just to come back to that point, it is beneficial to focus on any one of these, and even more so, all of them, but that can be done over time. So you can see here in this model, physical activity, diet and nutrition, social activities, socially stimulating activities, intellectually or cognitively stimulating activities, and good sleep, stress management, overall health maintenance, and medications that are not contributing to risk of cognitive decline and dementia, which I'll talk about at the end. These are all important. And there's really good evidence to show that doing these things in aggregate over time can decrease the chance of developing cognitive difficulties. So another important take-home message here is that a healthy heart is a healthy brain. A lot of what we know from lifestyle and brain healthy behaviors is derived from research in cardiovascular health that has been known for a longer period of time. So you can see these headlines from a number of professional organizations and the media talking about what's good for the brain is good for the heart. The heart and the brain are closely linked, and so we know that that's the case. So for physical activity, so there's a number of studies that show that regular physical activity 3 or more times a week, as an example, of 30 to 60 minutes is beneficial and has been associated with lower risk of mild cognitive impairment and dementia. If someone already has cognitive impairment and they're on the spectrum I described of mild cognitive impairment, improving their physical activity and aerobic exercise has been shown to boost memory and daily functioning. And so even though we may not be able to change the trajectory of decline for everyone, there's some evidence of stabilizing the trajectory and certainly improving day-to-day cognitive performance with physical activity and exercise. And so at the bottom here, you can see just for personal reference, the age group, 50, 60, or 70, and kind of a range of target heart rates. And so when you're doing aerobic exercise, your heart rate is going to go up a little bit, and you want it to be within that range to demonstrate what we call aerobic activity. And so some examples of that. So, so indoors, things like using an elliptical trainer, a stationary bicycle, taking group fitness classes or video classes. And I just want to emphasize, given what the whole world is going through now related to COVID and all of the challenges with in-person social activities, there are a lot of great options for video, group exercise, and group fitness. And I mean, even searching online and finding an exercise program that's free, that's led by an instructor that you can do in front of your computer or television is great and can be beneficial. Outdoors, walking or jogging, water aerobics, if possible, swimming, cross-country skiing. These are the different types of physical activities that have been investigated over time in these large population studies as being shown to be beneficial for brain health. And so one key is to, what do we mean by aerobic? So what we mean is that either your heart rate goes up a little bit, and you can, like in the reference ranges I had on the prior slide, you feel slightly out of breath, or you're sweating lightly. These are ways to know whether the exercise that you're doing is really eliciting blood flow to the, or really reflective of blood flow to the brain and increasing your endurance level. I made a note here, and this is a common question, that strength training, stretching, doing light weights, for example, is definitely beneficial and has been studied in these studies which kind of try to show decreased cognitive impairment or dementia risk. But they're not the key type of exercise. They are very beneficial for aspects of bone health and reducing risk of injury, etc. So incorporating both would be an ultimate goal, with a focus on aerobic activity. So for diet, so a healthy diet and a healthy weight. So in general, diets that are what's called anti-inflammatory diets have been shown to be the most beneficial in both brain and heart disease. So, and studies have shown that adherence to these types of diets, a Mediterranean style diet, which I'll come back to in a moment, is associated with a lower risk of conversion from mild cognitive impairment to dementia. And this is just an example, which you'll see in a couple of following slides, of the types of foods that are a part of the Mediterranean style diet. Fresh fruits and vegetables, beans, lentils, and nuts, and fish on a daily basis, for example. In moderation are items like poultry or lean sources of meat, eggs, dairy, and alcohol in moderation. And these anti-inflammatory diets generally avoid sweets that are not from natural sugars, that have some refined sugar. So, for example, the sugar that's in fruit or in maple syrup or maple products, for example, is a natural sugar that has not been refined. Sugar that you find in granola bars or in cereals are often refined and probably have more of a pro-inflammatory effect in the body. And so to go into a little bit more detail, this is an example prepared by one of our excellent nutritionists at Brigham and Women's, which is a guide for like practical use of food guide for adhering to a Mediterranean diet. So 3 servings per day of whole grains, for example. That includes brown rice, whole grain pasta. An emphasis on green leafy vegetables. Green leafy vegetables have higher folic acid and other antioxidants that are beneficial for the brain, at least 1 serving per day. Other vegetables are beneficial as well, and those are listed here, things like Brussels sprouts, cabbage, bell peppers, squash, etc. So things to keep in mind as you prepare your pantry. Olive oil, nuts. Sometimes it's easy because of the snack ability to go overboard with nuts. I think about 5 ounces per week is a general guideline. And those are of various different types of mixed nuts. Berries, beans, and legumes, these are all part of the diet, and berries, in particular darker berries, seem to have more protective effects based on studies that we've done. And fish and poultry. So in general, foods to limit or avoid. So foods that are red meat, which is usually beef, butter and stick margarine, pastries and other desserts, generally speaking, foods that are fried and foods that have refined sugar that are not sources of natural sugar. So we have evidence that when you follow people over time, older cognitively normal adults, that a higher adherence to a Mediterranean diet is associated with reduced risk of developing Alzheimer's disease, as well as slower rates of cognitive decline along the normal curve of aging as well. And so you can see here as an example, so from the beginning of a study until 10 years down the road, people in the black trajectory here had the highest adherence to a Mediterranean style diet and the lowest incidence of developing dementia or Alzheimer's disease. And this is a pretty nice study that is over 10 years of time. So you can see that the split between people who have the highest adherence to Mediterranean diet to a middle degree of adherence to a low adherence, there is a significant difference in the incidence of cognitive impairment and dementia. And some of the proposed mechanisms for why diet has this type of impact on the brain include probably relate to inflammation, and they include indirect impacts on blood pressure, cholesterol levels, which then have an in-turn effect on reducing vascular disease in the brain and reducing the development of plaques and tangles and other pathologies in the brain that are involved with dementias. And so you might hear, this is a slide that talks about some acronyms for these diets. So the MIND diet is otherwise known as the Mediterranean Dash Intervention for Neurodegenerative Delay, is a combination of these two other diets. The dietary approaches to stop hypertension diet, or the DASH diet, and a Mediterranean style diet, which is sometimes kind of the umbrella diet, which captures the elements of these other ones. The bottom line is that all of these three diets are very similar, and they're getting at the same idea, which is brain healthy foods that are low in their inflammatory effect. One of the differences, just to highlight, is the DASH diet allows for a higher consumption of dairy, and the Mediterranean style diet is explicitly involves more food, more fish, and also involves some moderate consumption of wine, and in particular red wine has been shown to have some protective effect, we think. These graphs just show, similarly to the prior slide, that the people that are on this blue curve, as time goes on, their cognitive scores are better than those on these other two red and green curves. And the blue curve represents adherence to these diets. The better someone follows this diet over years, the higher their cognitive scores are and the less incidence of cognitive impairment. Okay, social and cognitive activities. Keeping the brain active helps to preserve memory and processing. So some examples of that: doing crossword puzzles, jigsaw puzzles, card games. This can take many different forms. Taking art classes, combining social and cognitive activities together in the form of group classes is a wonderful way to achieve both of these recommendations. Earlier, the better. It seems that early changes in the brain that lead to dementia can happen, we think, 15 to 20 years prior to onset of symptoms. So the earlier in life someone can have a habit of these things, the better. This just highlights a study, a very helpful, interesting study of over 2,000 women in California, older women, where their social networks, that is how many people they interact with on a regular daily or weekly basis and in what capacities, were studied as a factor to see how they impact their development of cognitive impairment and dementia. And the conclusion of this study was that these women who had daily contact with friends or family had almost half the risk over time of their peers who did not of developing dementia. So this is just a testament to the protective effects of social networks on developing dementia. All right, so building cognitive reserve. So just a quick point about cognitive reserve. Cognitive reserve is a concept describing the resilience of the brain, the robustness of the brain. That is, in particular, how as we age and as the brain accumulates the stresses of life and medical conditions and various things that can happen, how much can the brain resist these changes and help people continue to stay mentally sharp? And to illustrate that in this chart here, you can see on the x-axis is age over time, and on the y-axis is cognitive function. And so let's go back first to this curve of normal aging. So as we age, this purple line, we have a slow decline in cognitive function over time. That's a natural, well-studied process. For people who develop mild cognitive impairment and dementia, there starts to be a split of these curves when they start to develop more memory difficulties at the same age. Again, all picked up, can be picked up by the health system, by cognitive testing, et cetera. And then they can go on to develop dementia. They have a higher risk of developing dementia down here. So for someone with a higher cognitive reserve at the same age as someone else who already has memory impairment, that person can have a higher cognitive function. And so someone with a higher cognitive reserve has better cognitive function at the same age as someone who has less cognitive reserve. So it's a protective effect. It helps people compensate for whatever is happening in the brain. So what contributes to cognitive reserve? So many of these modifiable factors we just discussed and some additional other ones. So diet, exercise, education or continued education, social support. There's studies on having a positive affect or a positive view, as well as treating psychiatric problems like depression and anxiety, continuing to find stimulating activities and novel experiences, and some degree of cognitive training. These all contribute to building the brain's robustness and contribute to this idea of cognitive reserve. There are factors that diminish cognitive reserve, and these include things like poor health, having poor behaviors around sleep, so not getting adequate sleep or having disrupted sleep, which can sometimes be due to a medical problem, which can be treated, but otherwise can be improved with good, healthy sleep behaviors. Smoking and untreated depression and anxiety can all contribute to less cognitive reserve. So 2 more sections, sleep and stress. So again, brain healthy behaviors and what you can do actively now to reduce the risk of cognitive decline and dementia. So sleep, so 7 to 9 hours. Let's go to this next slide. So the CDC has these recommendations based on studies that for adults in age group 18 to 60, that 7 or more hours per night is the general recommendation for adequate sleep. For older individuals, 61 to 64, the range is a little bit higher with 7 to 9 hours. And then above the age of 65, it drops a little bit, but they're all within the same comparable range of 7 to 8 hours. That diminishes a little bit when people get older. The need for sleep decreases slightly, but just being aware of it and trying to be routine about it is key. So what do we mean by sleep hygiene? So what we mean is behaviors that lead to better sleep, consistent bedtimes and wake-up times, consistent exercise during the day, which increases sleep maintenance at night, making sure your bedroom is quiet, dark, and relaxing, reducing stimulating activities right before bed, like stimulating conversations, television shows that keep the brain too active, avoiding large meals and alcohol before bedtime, and then treating medical problems if they give symptoms like snoring or excessive daytime sleepiness. That can all improve your overall sleep health. And lowering stress. So we know that stress or feelings of being overwhelmed have a direct effect on, ultimately, or can have a direct effect on cognitive and behavioral symptoms. So stress induces physiologic response in the body, which has been shown to have detrimental effects on brain structure and plasticity in the brain, that is the ability of the brain to rewire and to compensate, and also has direct effects on medical conditions, which themselves are risk factors for cognitive and behavioral symptoms. So we've talked about things like blood pressure and cholesterol, et cetera, and heart disease in particular in this case. So what can we do? So many different things, and people have all different ways of reducing stress and have developed stress, response behaviors. So mindfulness training is one. Mindfulness is a concept that focuses that helps us to cultivate a sense of being focused on the present moment in order to reduce stress and anxiety. There's a formal practice of mindfulness that is wonderful to learn and can be taught by instructors or through computer programs. Meditation, breathing exercises. I mentioned here that there's been studies of mindfulness training in older adults, and there's some emerging evidence of benefit for people who have cognitive impairment. There needs to be a lot more research that's done, but also in those who have subjective cognitive complaints, that mindfulness training can improve overall brain health. And finally, medications and supplements. So there are no existing prescription medications for mild cognitive impairment. That's the interim period between normal aging and development of dementia, which means impairment of daily functioning. And there are no prescription medications that reduce the risk of developing cognitive impairment if someone is an older, healthy adult. There are some over-the-counter medications and prescription medications that can sometimes inadvertently make cognitive performance worse and might have a risk of, might increase the risk of developing cognitive impairment. And some of them are really common over-the-counter medications that are antihistamines, for example. So I listed in this section over here that Benadryl or diphenhydramine is really common in over-the-counter sleep aids, for example, and it's commonly recommended. And especially in the older age group, it can cause immediate difficulties or adverse cognitive performance or memory difficulties, and should generally be avoided on a regular basis. There are some prescription medications I listed here. There are medications used to treat blood pressure, heartburn, and overactive bladder. I mentioned the names here, for example, that have certain properties that are anti-memory. They work actively, not unintentionally, but actively against the normal process that the brain uses for the neurons to talk to one another. We call these anticholinergic medications. And so it's worthwhile being aware of these things. This is not something that you have to know, that you're responsible for, but it'd be helpful to talk to your doctor or your family or your primary, your providers to address these, because it could be that you're doing all of these brain healthy behaviors, but in addition, there's a medication on board or there's a supplement you're taking that is kind of countering the efforts a bit. And so it's just important to recognize that. I put over here substances, smoking. There's been evidence that quitting smoking at any time can yield benefits to the brain or stop any kind of process that's detrimental in the brain. In particular, smoking has a relationship with cerebrovascular disease or what can result in vascular dementia or cognitive impairment. And so quitting smoking is an important behavior, of course, not just for brain health, but for overall health. And then I put in here marijuana as well. So, cannabis, marijuana is under an active area of study all across neurologic diseases. There's been evidence of benefit for CBD oil, which is a derivative of marijuana, for example, for people with agitation in dementia. And so it's an active area of study. The point of me mentioning here is that regular daily use of marijuana has been associated with cognitive difficulties and cognitive impairment. And so chronic regular use is not suggested and should be considered in this context. And then finally, these are some kind of evidence of a particular vitamins and supplements. I chose 3 here, vitamin B and B complex, which includes B12 and B6 often. So for cognitively normal individuals, none of these has robust enough of evidence to suggest that people should take them for this reason. However, there's suggestion of them being helpful. So there have been some studies that have showed improved memory and cognition in cognitively normal older adults that take vitamin B complex. There's been a suggestion that vitamin E is also beneficial and associated with less cognitive decline. And multivitamins, however controversial, there doesn't seem to be benefit in healthy older adults for a multivitamin as far as cognition. There is some scant evidence of a multivitamin in older individuals for reducing all causes of cancer and overall health that have come out from some of the large population-based studies. But this is a common question that we get in the neurology and memory clinic about multivitamins, and there really isn't enough evidence that they should be taken for the purpose of brain health. For people with cognitive impairment or Alzheimer's disease, deficiency in vitamin B, for example, in particular vitamin B12, is important and can exacerbate the problem of dementia and cognitive decline. And the way that this can be evaluated is just by blood testing. And it's something that can be done in any primary care or other office. There's been 1 to 2 studies which have shown that vitamin E supplements in patients with impairment can have some benefit in slowing functional decline. And so therefore it's recommended by some providers who work in memory clinics, although there needs to be probably additional research that's done. And then for multivitamins, there have been 1 to 2 studies which have shown some benefit, again, in people with impairment already to take a multivitamin. But again, there need to be better and longer studies over time to really prove that. I mentioned ginkgo biloba, vitamin D, and ginseng here amongst others, which are commonly brought up to us in the memory clinic. And there have been studies for patients with cognitive impairment in many of these supplements, again, with hints of benefit, but not enough to rise to the level of consensus recommendations. And then finally, supplements. There are many supplements out there that have been marketed as boosters of the brain or natural cures. These are sometimes called nootropic medications. Many of them either have not been studied completely enough for safety or for effectiveness. There might be 1 to 2 studies that are cited, but in general, I think talking to providers is really important here to get whatever the evidence basis is behind these things. And I'll just quickly say blood pressure control, cholesterol level control, keeping sugars at normal levels, healthy weight, and managing depression are all important for overall health and for reducing cognitive decline. So getting involved. So we need people for research, and there's many different ways to be involved. We need people from all backgrounds, ethnic, cultural differences, people of different income levels, education level, etc. And it's really important to understand the benefit of brain health behaviors for all of us. And so this is just a call to action if interested. For anyone, for you or for a loved one who's interested in research. As Jennifer mentioned at the beginning from the Global Alzheimer's platform, we are all working together in a large network. The Brigham Women's Hospital and Mass General Hospital are part of many centers across the country that are doing research to try to understand cognitive aging, risk factors for dementia and related Alzheimer's, dementia, and related diseases. And so please consider, and let me just segue to my last slide here. So the Center for Alzheimer's Research and Treatment, where I work and where I work with an amazing group of people here, is one place to go for additional information. And we have ongoing studies in for people who don't have impairment, but who are older and who have risk for decline, as well as for people who already have symptoms for cognitive impairment. The contact information is here, and also, however you found out about this seminar too, you're more than welcome to be in touch with the organizers as well. And I'll just leave, I'll put this last slide up. So at Mass General Hospital, there's a similar group of amazing people that are running clinical trials that's called the ACTRU. They are located in Charlestown, Massachusetts, and here is their email address as well. So I thank you for coming to this virtual talk, and I want to answer questions and be as helpful as possible.
Seth, you have a couple of questions. One is, can you comment on metaphobic, if it helps with people with MCI?
Okay, so maybe methylfolate is what they're describing. So I think that folic acid and methylfolate as part of the natural elements of foods is probably the best recommendation I can give. That is foods that are rich in methylfolate and folic acid. There's not enough evidence from clinical trials, that is where you give someone methylfolate and then a placebo and you study over time to see the risk of impairment, to really recommend it as a supplement itself. But I think that focusing on the Mediterranean diet is the way to go.
And another question is, can you speak briefly on references for studies on marijuana use in cognition?
I can't by the name of a study itself. I can tell you that, again, just to emphasize that for cognitively normal older adults, there's not enough evidence to show the protective effects. It is true that the active ingredients in marijuana do interact with the underlying pathology of Alzheimer's disease, which includes amyloid plaques in the brain and things, but there's certainly not enough evidence of protection for cannabis and marijuana for normal cognitive impairment. I'll just mention that for dementia, for the behavioral manifestations of dementia, there's some kind of growing evidence of benefit of reducing those behaviors.
Okay, that's the last question that you have. Somebody asked about a reference to how to get in contact with clinical trials, and we'll be sending additional information out after today's presentation, as well as I've shared email information in the chat box.
Fantastic. That's great. I think, go ahead.
We just got one additional question if you have time.
Absolutely.
I'm surprised to hear that poultry should be limited to prevent dementia. Could you explain that a little more? Thanks for your presentation.
So I think that poultry is, so the way that this information is derived is when you ask people over time and you follow groups of people and ask about their diet, you start to kind of add up what seems beneficial, what doesn't, based on whether people develop cognitive impairment or dementia. And so I think that poultry is not deleterious, and should be, not consumed. It's just that there are other sources of protein like fish and beans that seem to correlate better with less cognitive impairment than chicken and other forms of poultry. And if you remember, there was a slide that I showed which had poultry in if you think about red, yellow, and green for green being things you should eat all the time regularly, yellow mean things that you should eat in moderation, and red things that you should avoid. Poultry was in that middle category of moderation. So I think it's just not as well studied in its correlation to, in its association with the Mediterranean diet as other sources of protein, if that makes sense. Hopefully that was helpful. The diet is very complicated.
Excellent presentation. You've gotten lots of nice comments. Thank you.
Sure.